Good afternoon, Eugene, and all of you attending the Global Wellness Equity Conference 2026 in Kigali. Thank you for inviting me to speak on the structure and key activities of a wellness program at institutional level. I will focus here on hospitals and teaching institutions and using my own experience of well-being, beginning as a medical student. It was during medical school I first became aware of the need to consider my own well-being. I remember learning this after experiencing an uncomfortable interaction with a patient. I sought advice from the very wise and approachable vascular surgeon who was my clinical supervisor on that placement. He helped me to debrief the situation, to understand how my inexperience had contributed, and to obtain the learning I needed for future interactions with similar patients. Later, as an anesthesia trainee, I was mentored by another wise colleague who supported me when I failed the Part 1 exam to seek psychological and learning assistance. The conversations I had with my mentor were as important as the specific strategies given to increase my chance of exam success, as they showed me that asking for help was considered okay. After training finished, from early in my consultant career, I mentored others and became involved in mentoring activity in the department. I observed and began to learn from senior anesthesia colleagues who were dealing with the issues of drug diversion and poor mental health in trainees in our department. I began to educate myself by reading, attending talks at conferences like the ones you're hearing today, and did specific training courses, including how to provide supervision taught by a social worker. This last training I used to guide my mentoring practice. There was not, and still is not, any training to be a welfare officer, now known as a wellbeing advocate. During my time as lead wellbeing advocate in my department, I had to engage with clinical and institutional leadership. So my answer on structure starts with leaders. I realised the difference it made when a leader had awareness of well-being. Leaders have the responsibility and authority to support and improve well-being for those they lead. It was impossible to make improvements for well-being without the support of leadership. However, even leaders who have well-being awareness are busy. In our institution and wider region, leaders with well-being awareness delegate to well-being advocates. This is a role for people who seek knowledge and develop skills to support and enhance well-being through education, advocacy, and collaboration, as outlined by WFSA. This means promoting positive well-being strategies such as the one you're enjoying this week, and to prepare to respond to collegial distress when it happens. Additionally, at an individual level, everyone has a role to play in their own well-being. So having described how I see well-being structured from leadership, well-being advocates to individuals across levels in an institution, I'll now move to mention key activities. Like Eugene, I'm an anaesthetist, and we love to arrange our priorities as checklists. I propose we can think of the items needed for our personal well-being as a for ordinary times checklist. Some of the items on this list are common to all of us, such as eating, exercise, resting, sleeping, spending time with family and friends. Others are individual, like knitting, learning French, and choosing whether to swim or play volleyball as exercise. Each of us needs a list like this to remember to look after our own well-being. This is where our institutions often try to make suggestions or even help with vouchers and discounts, but sometimes it isn't enough and we exhaust what's on this list. When this happens in theatre and we get to a place where the list is not enough, or we need help to do what's on the list, we push an emergency bell to ask for more help. For individual well-being, this becomes a "can we talk" checklist. On this list are the people or types of people we might access when we experience distress or need to gain new understanding about the state of our well-being. Everyone from the leader to the individual needs to have a list for ordinary times and a Can We Talk list ready to go for the hard times. A wellbeing advocate needs a personal checklist to look after themselves so they remain available and approachable to others, but they also need a checklist for wellbeing activity. This list will include personal wellbeing education and reflection, local resources about where to refer others needing professional help beyond the collegial space, and areas of knowledge and skill in a range of types of distress commonly experienced by doctors. Finally, a leader will need a leadership checklist, which might include doing a department needs assessment, supporting the wellbeing advocate, supporting wellbeing initiatives, for example, putting the World Health Organization briefing and debriefing processes around the sign-in, time-in, sign-out World Health Organization surgical safety checklist as recently occurred at my hospital. I met Eugene, now Deputy Chair of the Workforce Wellbeing Committee and your very own wellbeing advocate and leader, because over time this work led me to have the privilege to chair the WFSA Workforce Wellbeing Committee. As a lifelong learner, I recently finished in that role, and although still a committee member, I have now prioritised completion of my master's thesis, learning how to use qualitative methods to understand the impact of complaint on hospital doctors. Perhaps that's not for everyone, but wellbeing certainly is. Safe, high-quality care can only be delivered by doctors who are functional and well. This requires both individual and institutional responsibility. I think wellbeing can be structured and lead to key activities within institutions at all levels, from leaders and wellbeing advocates to individuals. Start and finish always with your own wellbeing, but working for others along the way. Armed with an ordinary times checklist, a Can We Talk checklist, a wellbeing advocacy checklist, and a wellbeing through leadership checklist, I think that institutions can take better care of our wellbeing. Thank you again for inviting me to speak. I am happy to receive questions via Eugene, and I wish you all well for your conference and your future wellbeing activity. Thank you.